Here in Missoula County, we are definitely seeing an increase in flu activity, particularly in about the last week or two. We were seeing pretty steady what we would expect, other than the fact that it was a little early. It was about a month early that we started seeing cases. But in the last couple of weeks, we've definitely seen a huge increase in the number of flu cases that are out there.
And is it any particular strain of flu, or is it just kind of this, severe flu that we've been hearing about?
The strains that are circulating right now are very closely matched with what is in the flu vaccine, so that's a really good thing. But what we're seeing is a lot of flu A's. We're not seeing any H1N1 at this time. It's just your typical seasonal flu A and flu B. We're seeing a lot more A's than we are B's, but they are both out there circulating right now.
A lot of people, of course, remember the H1N1, the whole pandemic here a couple of years ago, and that's maybe still fresh in their minds. But maybe compare that scenario with what we saw 2 years ago with what is starting to crop up this winter.
So what we saw 2 years ago was kind of an anomaly flu. It was, just a much different strain. It was something that was really circulating all year long. This is more of a seasonal, it's a typical seasonal flu. The only difference is that what we're seeing compared to like what we saw last year is that the flu that's circulating this year is a lot more severe. And so people are getting sicker from it, which is why we're really encouraging people to get their vaccine, get that shot, because it definitely is going to help keep you well.
And the good news, like you were saying, I guess this vaccine that we're dealing with now seems to pretty well cover the strains and everything we're seeing.
Yep, so far what we're seeing in Missoula County, the flu that is circulating is well matched with the vaccine, so it's covered. The vaccine is widely available, unlike 2 years ago when we were dealing with a lot of H1N1 that, the vaccine was harder to come by. But as far as we're hearing here, the vaccine is widely available. We have it here at the health department. You can get it mostly at your doctor's office. You can get it at some of the walk-in pharmacies. So we definitely would encourage everyone to get vaccinated.
And of course, the standard precautions, even with vaccination, as you talk about, washing the hands, covering the mouth when you cough. What about some of those? That's a big part of this, isn't it?
Yes, and some of the things that we want to encourage people is that if you do start coming down with flu-like symptoms, which is the fever, body aches, congestion, cough, it can last up to 10 days. Typically it's, you can kind of feel it coming on a day or two ahead, and then you feel really crummy for, several days. If you start having those kind of symptoms, we definitely want to encourage you to, contact your doctor. Don't go into the emergency room unless you're really feeling like it's an emergency, but give your doctor a call and let them know what kind of symptoms that you're having. Just try not to be out in public where you can spread it to other people. And again, wash your hands, cover your cough. Try not to expose people that are around you.
And because it is severe, this is that situation again, especially the at-risk populations, the kids and the elderly, we want to especially take care of them. Yes,
definitely. The elderly and the little kids are definitely at higher risk of developing complications from the flu, as is the same every year. So it's particularly important to kind of cocoon them and make sure that those folks that are at the highest risk are not being exposed.
So I've seen some reports indicating, this could be the worst in a decade. I don't know how you quantify that necessarily, but it's something we need to be careful of this time.
Yes, definitely, especially because we are seeing such widespread flu activity at this time, and some of the cases that we're seeing are much more severe, and people are developing some complications. It is just something we won't really know until the end of flu season if this truly does end up being like the worst that we've seen in a decade or whatever. But it's still important to kind of keep that in mind and take those extra steps to protect people around you.